Stuff. Kathy Sunland on the other end of the phone with us. She's the director of nursing at Bronson Commons, which is a post-acute rehab and skilled nursing facility. And Kathy, this is a facility that maybe a lot of people don't know what their mission is, and it's specifically designed for a certain type of patient.
Oh, that's very correct. Really, we geared our building and our services to bridge the gap between hospital and home. We are licensed as a skilled nursing facility, but our mission and our goal is to provide that transitional care between the hospital and somebody being ready to be independent at home.
All right, so this would be a transitional facility. Say, for instance, they're getting out of the hospital and they still need that care, but they wouldn't get it at home, but yet it's not something they need to stay in the hospital. And this really works out well, I guess, with the healthcare system because it shortens up the hospital visit, but it still provides them the medical care that they need.
Yep, you got it. Oftentimes somebody's really not sick enough to stay in the hospital, but they're not quite ready to go home and be safe in their home environment. Maybe it's somebody who had knee surgery and they've got steps that they need to maneuver at home. So they need to be able to go up and down those steps safely and be ready to jump back in. So that's where we step in, and we can provide that therapy that they need, work with them to recover and be stronger and ready to go home and be independent.
Kathy, let me ask you a question. Is this limited to, say orthopedics, or is it a wide-ranging? I mean, are there any specialties or, a lot of specialties that can utilize this type of facility? Oh,
no, we're not limited at all. We actually cater to a wide variety of different things. People who have orthopedic-type surgery is a great example, but we also work with a lot of stroke patients. We work with accident victims, like auto accidents. Even someone who's had pneumonia and they're weak and they are not able to provide that care that they need at home quite yet. So all kinds of an array of medical conditions as well as physical.
And I've noticed that this continues the tradition of Bronson and that all the rooms are private.
Yes. Oh, and they're gorgeous. I'm a little prejudiced because I was involved with helping lay these out, but we have 100 beds that are all private rooms. Each one has a private bathroom with a shower, and every single room in this building has an absolutely gorgeous view. We're back in a wooded area, and it's very, very peaceful. It's beautiful views wherever you're at.
Go ahead.
Oh, I was going to say we really tried to set those rooms up to provide a calm, peaceful environment for people to heal.
That was my next question, Kathy. Where exactly is Bronson Commons located?
Oh, good question. We are in Mattawan, actually right off of Red Arrow Highway, not too far from the exit on I-94, the Mattawan exit on I-94. Actually just right around the corner from there, and we're set back in the woods, Bick.
So if you're a patient, you're an inpatient at Bronson, and it would appear that this is going to be the best place for you. The discussions will take place with family and whatnot at the hospital so that the transition can be smooth?
That's correct. Yep. We work with the case managers at the hospital, and we have an intake nurse, a nurse liaison by the name of Marcia Gabrielson, who works side by side with the case managers downtown and can actually go in and meet potential patients and their families, answer questions, and help them prepare for whatever transition that they need to make, and also help our team prepare for that patient's arrival. So it really helps for a smooth transition.
Talking with Kathy Sunland, Director of Nursing at Bronson Commons. Kathy, when there isn't probably a set amount, but what is the average stay at Bronson Commons once a patient gets there?
Average stay is in days?
Yeah, stay is in days.
Okay. Right now, our short stay is running at about 17 days. Many people are leaving actually after about a week. So again, you're looking at that short transitional time. They're really not sick enough to stay in the hospital, but they're not ready to be home. And then on the flip side of that, we have other individuals maybe who have more complex medical or physical needs, and that are here a month. And so our average is running right around in between there at about 15.
If there are families or people out there that just want more information on what Bronson Commons does and how maybe to get some information, because it sounds like something that they may have to look into, is there a place that people can go?
Yes. Actually, the easiest is to simply call us. The phone number is 269-283-5600. 5200, or even stop in here, and one of our social workers would be happy to talk to someone, give them a tour, provide all kinds of information, and answer any questions that someone might have.
And what's the information again, Kathy?
Phone number is area code 269-283-5200, and we're located at 23332 Red Arrow Highway.
And that is in Mattawan.
Yes.
Indeed. Kathy Sunland is the Director of Nursing at the Bronson Commons facility. It's a post-acute rehab and skilled nursing facility. Thanks so much for taking time out to talk with us today, Kathy. We appreciate it. Have a wonderful day.
Thank you.
Stay out of the snow.
All right.
Thanks. Take care.
Yep.
Kathy Sunland is the Director of Nursing at Bronson Commons, which is a post-acute rehab and skilled nursing facility out in Mattawan. Very nice part of the healthcare system.